Friday, January 12th, and it's time for your first legislative update for the 2018 calendar year. It's been a while since we've talked. We took a break over the holiday. The legislature took a break over the holiday, but then they came back this week on Wednesday, and it looks like we're going to be here for a while. Before I get to that, I want to talk a little bit about a new Legislative Research Commission committee that has been started. It's on rural access to health care. And we were asked to speak along with the Shep Center and many other folks on Monday. That article was the lead article this week in the bulletin that detailed all the speakers, what they talked about. It has a link to the testimony that I was able to give on our behalf. And I wanted to say thank you because you, many of you, 375 of you, were very helpful in giving us some new information that we could talk to the committee about so that we could have a conversation about why you're living and working in rural areas, or why you would want to live there and work there, or why you're not really interested in doing that at all. And we appreciate that information. That feedback was a part of our new snapshot survey. That is something that we've been trying out, and it seems to be working really well. We're getting a lot of positive feedback from you on that, and it's great to see how useful it was in just the second time. Like I said, we came back this week. We came back with what could have been a really big agenda. There were about 8 different items that the legislature was looking at possibly taking action on, and they ended up only taking action on a few appointments. They haven't really settled on anything, and we're going to stay in skeleton session now, which means that we're going to be meeting in committees but not taking daily votes in the legislature for some lengthy period of time, probably at least till the end of January. So we're going to bring you a briefing for the next couple of weeks to update you on what those committees are, what is happening down there. We're watching closely, especially on Medicaid transformation, because there are still 2 Medicaid bills, House Bill 403 and House Bill 156, dealing with what would be a part of transformation in the behavioral health world, that's House Bill 403, and how these new prepaid health plans would be licensed, which is House Bill 156. We're still expecting changes to be made to those and them to be passed at some point in time, and we think possibly in this special session. While all this has been going on, it's been really busy at the federal level. Folks just came back from a holiday there and immediately are having to deal with the budget issues. And I'm sure you've read in much of the national news sources that that is highly controversial because they're trying to figure out what to spend money on and what not to spend money on. The thing that we've been watching most closely in there is the reauthorization of CHIP, the Children's Health Insurance Program. And we'd ask you to share your voice along with thousands of other doctors in making sure that that reauthorization actually happens. We have too many children in North Carolina that rely upon that program to get access to care to be silent on this issue. So reach out to your congressional legislator and make sure they know that you want to see that included in the new budget. Until next time, watch the website for any late-breaking updates to make sure there's not something that you can take action on immediately. But we'll be back with you next week to tell you what happened here in Raleigh and if there are any updates at the federal level. Have a good one.